There's a possibility that I had Lyme bacteria. I think most of us have heard Dietrich Klinghardt talk about the fact that 270 million Americans are infected with the Borrelia bacteria. And only because our immune system is not compromised quite enough to let the bacteria take over, it holds it at bay. Once, because of stress or because of some major stressor hits, that's when the bacteria can go really crazy in our bodies and start doing the damage it does. Let me see if I can remember to play something that you'll hear. Ago, I was so weak and losing so much time due to the fact that I had to be in a chair constantly, a zero gravity chair. I couldn't stand, I could barely walk, I could barely function. When I was diagnosed with Parkinson in 2008, I somehow knew that it wasn't Parkinson that I was really challenged with. I had come back from a backpacking trip in Utah, and my ankles and my knees, my hips were swollen. They stayed swollen for about 6 months. 8 months after I came back, I was just deathly ill. It's like all my muscles are on fire, and they're so tight, and it's so hard to even. So in 2012, we got confirmation by doing a blood culture, where they cultured bacteria in my blood over an eight-week period, testing like no other labs could do to verify the presence of Borrelia bacteria. So here I was really struggling to hang on. When I say hang on, I'm really talking about hanging on in life. So I hired a chef to come in and cook for me because I couldn't cook for myself. I was ready to give up, meaning I was ready to cash it in, call it quits. Not that I would commit suicide, and I was looking for some way to just check out. Before I came here, I had no appetite. The chef who was cooking food for me said he had not seen me eat as much as I've eaten in probably 6 months, as I had begun eating when I came here. And a week later, after being here, just a few treatments, I began gaining weight again, and I had an appetite, and I felt like living again. About 2005 or 2006, standing at the morning shower in the mirror, looking at the mirror in the shower, which I had a little shaving mirror, trying to shave, and I noticed I couldn't shave my face with my left hand. My left side quit functioning. I was having tremors. I started experiencing what I didn't know at the time was anxiety attacks. The reason I was so confident in my resistance about accepting a Parkinson's diagnosis was because in the research I'd done, I knew that the bacteria responsible for causing Lyme disease has a lot of symptoms it creates that mimic Parkinson's, MS, ALS, or Lou Gehrig's disease, Alzheimer's, you name it, just about any kind of neurological disorder or dysfunction. I was begging to die. I was in so much pain. I lost 65 pounds. I looked like a prisoner of war. I was treated also back in 2013 in a similar type clinic in Florida that just did not have the capability of doing what Envita does. I had never heard of Envita up until probably middle of August. I was talking to a practitioner that I've been using on my healing path for the last year. And given that I was in a chair for 9 hours a day, I was looking for answers. I was looking for a way to regain some of my life. And as Jan and I were talking, she mentioned Envita Medical Center for the treatment of Lyme disease. And I immediately got online and found the information on Envita. And I knew when I heard Dr. Prado speaking about the co-infection elements of Lyme disease, that's where I knew that Envita was onto something. Because in my experience, nobody else was treating the co-infections successfully. And nobody understood what the co-infections were. Once I knew that Envita was the place that I needed to go to successfully rid myself of Lyme once and for all, I got here as quick as I could. When I arrived here, let me show you. Let me pull up some notes I had. The symptoms were tremors, shuffling movements while I was walking, difficulty turning when walking. My body would lock up during what I call neurological crashes. I had difficulty getting comfortable in my zero gravity chair. I couldn't type on a keyboard. I had difficulty reading a book. Just holding it to read, I couldn't do that. I had difficulty with bowel movements because when my neurological system shut down, it shut down everything. I had difficulty speaking. I would appear to be quietly mumbling. I had difficulty swallowing, and I had anxiety, what I call mini anxiety attacks, depression during the crashes. I had great difficulty getting out of a chair when I first got here in August. I needed help getting out of a chair. And after about 2 weeks of treatment, that went away. So now I can very easily just stand up at will, not need anybody to pull me out of the chair. My appetite came back. I mean, you talk about a voracious appetite. The hope I have is that what I'm experiencing in the good, vibrant, fulfilling portions of the day that I now experience, normal function. The hope is that I can expand that as I progress through life. I regain even more than I've regained recently through the treatment. So what I can do is keep working myself through meditation, building a spiritual foundation of belief that supports my becoming even healthier than I feel I've become.